Hello and welcome to my comprehensive physical exam video. We will be going over the complete physical examination on somebody while also going over past medical history and vitals and so forth. So my patient today is going to be Mr. Espinoza, who will be walking in right now and will be sitting here. And the video will show me doing a complete physical exam on him. There are a few things that'll be a little bit different on this exam as compared to how you would normally do an exam on somebody. Normally you would have an examination table and they would probably be wearing a gown so that you could auscultate a little bit better over their clothes or underneath their gown. You could also palpate for organs and so forth. So we're not going to do those, but I'm going to show how you would do those things. I also don't have a tuning fork. But when we go through the different sensory functions, I'll be discussing what I would be doing at that moment. Okay? You can come in, Mr. Espinoza.
Okay.
So, Mr. Espinoza, I was looking over your past medical history, but first, can you tell me your full name and date of birth?
Gabriel Espinoza, March 25th, 1989.
Okay, that matches. Okay, so past medical history, I see that you were born premature. Mm-hmm. You were born with a club foot to the left foot that was eventually surgically repaired when you were 16. You were born with one kidney on the right side. You require glasses. And you have seasonal allergies. Anything else you can think of? Personal and social history, the only thing that you're positive for is you consider yourself a moderate smoker. Mm-hmm. How many cigarettes do you typically have in a day?
3 to 4.
Okay. Do you have any desire to stop smoking?
Yes.
Okay, then we can kind of discuss that later. Do you drink alcohol?
Yes, occasionally.
Occasionally. How many drinks would you say you usually have in a given period?
Maybe like 2 or 3 drinks a week.
Okay. And for family history, I see in your chart your family is positive for diabetes on your mom's and your dad's side?
Yes.
Okay. Brain tumor, history of cancer and colon cancer on your paternal side? Mm-hmm. Okay, anything else?
No, not that I can think of.
Okay, so I'm going to be taking some vitals and then we'll go over the whole exam, okay? So first, let me just hook up your blood pressure. We'll do it on this side. Okay. And when I do your blood pressure, you want to make sure that your legs are not crossed and that you just try to be as calm as possible. Sometimes we get nervous. Okay. Usually there's not a cat in your assessment too. Okay, 122 over 80.
How terrible is that?
That's not terrible.
Am I dying?
Usually 120s over 80s is pretty typical, but you're also, an exam. So at the end of it, we'll retake it just to see. Okay, I'm going to take your heart rate. heart rate is 80 and your respiratory rate was 12. Okay. And your weight is 180 pounds and your height is 5'9"?
Yes, ma'am.
Okay. Alrighty, so I'm going to adjust this a little bit. Okay, so I'm going to be facing you and I'm just going to be starting from your head to your toes, okay?
Can I take my mask off?
Sure. Okay, so we'll look at the head. We're feeling his head. It's normal cephalic. There's no deformities noted anywhere. There's no open sores anywhere. Can you turn your head this way? Okay, there's no sores. Can you turn your head the other way, please? Okay, no head deformities. His hair is brown. It's curly. It's normal for his ethnicity. Now we're going to look at your eyes. So first what I'm going to do is, normally what you could do is you could do a visual acuity. Normally you would have like a Snellen chart and you would have them, you typically would have a piece of tape that's 20 feet away telling you that this is 20 feet away from the Snellen chart so you can start to see are they 20/20, but we already know that he requires glasses. So we could have him do the Snellen chart. You could do it with and without glasses to see how he does, but you could also ask your patient, are you nearsighted or farsighted?
Nearsighted.
Okay, and that kind of lets you know whether it's easier for them to see near or whether it's easier for them to see far. So we'll look at his eyes. They're equally spaced apart. There's no discharge noted. There's no redness noted. The lids are intact. They're equal. He's got eyelashes on both eyes. So I'm going to shine a light in your eye. Okay, so the conjunctiva looks good, no redness noted, no swelling. I'm just going to pull your eye down and look at the sclera. The sclera looks good, it's pink, there's no discharge noted, no objects or any kind of odd pieces of fuzz or anything in there. I'm going to shine a light in your eye. His eyes are brown and pearl is intact. Okay, I'm going to have my hand come over here, just look forward at me and tell me when you start to see my hand. From over here. Okay, so he's got his intact peripheral vision without needing to look anywhere. The iris and the lens they contract to light easily. There's no corneal abrasions noted. They both retract to light easily. He's positive for Perla. If you could look, okay, so you're going to look at me straight and then you're going to follow my finger, okay? Now this side. And he's got equal range of motion to his eyes, okay? When I was looking at his eyes with the light, you could also see the ocular fundi. Everything's intact. He came in with glasses, so I didn't notice any contacts that were in there. Sometimes that's something, to be aware of with the patient if they're wearing contacts at all. You can put your glasses back on. Okay, so next I'm going to look at his ears, and I have some speculums over here that I'm going to use. So I'm going to have you look that way. So normally you would have a real otoscope, but I am making a makeshift one with a little speculum and a light. I'm just going to move your hair. You can put the speculum inside, and you can take a look at the ear. You can take a look at the eardrum to see if there's any objects, if there's a lot of cerumen in there, if his eardrum is intact, which it is. While you're looking inside the ear, you can take a look to make sure at the auricles and take a look at the outside of the ear. He doesn't have any piercings. His skin is intact. There's no redness noted. Do you have any tenderness in your ear? Okay, if you could turn to the other side, I'll take a look at the other ear. So it's pretty easy to do things step by step, but you can kind of combine things all at once while you're doing things. While I'm looking inside the ear, no cerumen. His eardrum is intact, and again, his skin is intact. The auricles are clear. There's no discharge noted. Do you have any tenderness? Okay. So part of the ear exam is looking at the physical, but then you also want to look at this. You are thinking about the sensory as well. So one thing that you could do, you can do a whisper test, where I would stand about 1 or 2 feet away. You can exhale deeply to make sure that you're completely whispering, and you can say a few words to see if they hear you. So I'm about, maybe a little bit more, I'm about 3 feet away. So I'm going to exhale completely. What did you hear?
Cat.
Did you hear it in both ears the same?
Most I heard in my mouth.
Okay, well let's try this side over here. Now I'm about 2 feet away from him over here too. I'm going to exhale deeply.
Cat.
And you heard it well equally in both ears. Something that you can also do in your exam is a Weber and Rhine test. You would be using a tuning fork. It usually it looks like a little Y, and it's a metal, it looks like a metal piece of, like a huge metal fork. And you would tap it against your hands, and you would put it on the middle of their head, and you would ask them if they can hear the vibration equally in both ears. If they tell you, usually they'll tell you yes, they hear it equally. If they happen to tell you that they don't hear it equally in both ears, you can try it again and have them occlude one ear and ask them where they heard it best, and they should hear it best in the occluded ear. You can also do the Rhine test, which looks at air and bone conduction. And you would use the same tuning fork. You would tap it against your hand, and first you would put it on the bone right behind the ear, right here. And you would tell them, you know, do you hear the vibration? Typically, they'll stop hearing that after a while. You'll move the tuning fork in front of their ear, and they'll continue to hear the vibration because air conduction lasts longer than bone conduction. And what you can do is you can count the second intervals between how long it lasts for them to hear it behind their ear and how long it lasts for them to hear it in front of their ear. But like I said, the air conduction is going to be longer than the bone conduction. So once we're done with that, you know, we've already started to look at his face, and we've looked at the eyes. Now we can look at the nose. So we're going to inspect the external nose. It's even, it's not deviated to either side. His nasal passages and sinuses, from my view, are clear. There's no drainage noted. You can start to kind of palpate a little bit. He doesn't have any deformities noted, no acne. So then with the light and another speculum, you can look inside the nose. Everything, his sinus passages, his nasal passages look clear. He does not have a deviated septum. There's no drainage noted in here as well. He's got a very clean nose. The mucosa is clean, dry, intact, but it's not overly dry. You can still see that there's still some moisture in there, which is what you want. You don't want an overly dry nose, but that can be common in El Paso as well. We're going to also palpate, I'm going to take off the glasses for a second, the frontal and maxillary sinuses. Do you feel any pain?
No.
No. Have you ever had any sinus pain before?
Just when I get really stuffed up.
Okay. And that can be common too, especially in El Paso. But you want to make sure that you palpate the frontal and maxillary, because that can kind of give you an indication of maybe there's a little backup in there or some kind of allergic response. Next, we're going to look at the mouth. So his lips are intact. They're dry but not cracked. He looks like he's well hydrated. They're even, they're red. If you could open your mouth for me. Now you can use another light. You could use a speculum if you want. Could you stick out your tongue for me? And see, that's another sensory cranial nerve function that you're testing. He's got equal protrusion of the tongue. His tonsils I would give 1+. All his teeth are intact. No visible cavities noted. The oral mucosa is clean, dry, and intact, but not, like I said, not overly dry. It's still moist. His tongue is red with no fissures noted, no kind of deformities noted. Can you go like this? Can you smile for me? Can you frown? And that kind of lets you know, too, that he has equal movement. And as he's talking to you, you can see if your patient has equal symmetric movement on their face as well. So next we're going to be palpating the thyroid gland. So something you can do is typically you'll have a little water or something, so I'm going to have you drink a little bit of water. You can look at from the lateral side, and you can, go ahead, you can swallow. Take another sip. And you can kind of see if there's any kind of deformities, anything that bulges when he swallows. So I'm going to have you swallow again, but first I'm just going to palpate. So I'm palpating for the thyroid gland. The size feels within normal limits. The shape is normal for the adult size. The configuration is normal. The consistency is normal. Do you have any tenderness? There are no nodules noted. It's small, it's smooth, there's no nodules. Can you take another sip of water for me? Hold it in your mouth for a second. Swallow. And it rises and falls with swallowing, which is something that you also want to be looking for. Next, as long as you're on the neck, you'll also be palpating for the cervical lymph nodes. So you'll be looking for superficial, you'll be looking for the posterior, you'll be looking for deep nodes, and then you'll also be looking in the supraclavicular areas. Do you notice any tenderness? Have you noticed any enlargements around here at all? There are just no palpable lymph nodes noted in the cervical area. As well, when I'm palpating the thyroid gland as well, I can feel that it's equal between the sternocleidomastoid muscle on both sides. Then so while I'm feeling along for the thyroid gland, I can also feel for the trachea. It's not deviated to any side. There's no tugginess noted anywhere. It feels normal on both sides. There's no nodules, there's no tenderness. Okay. So while we're here, we can take a listen for a thyroid bruit. And you would use that with the bell of your stethoscope. And while you're doing this, you can also listen for carotid bruits. No thyroid or cervical or carotid bruits, noted. So now that we finished with the head, neck, throat, mouth, ear, nose, now we're going to go towards the back. So if you could turn around in your seat for me so that the back isn't facing me. You can sit down if you want here. We'll just flip the chair around. Sorry. Okay. So what you're going to do is you're going to just inspect and look at the back. I'm going to be palpating the cervical and thoracic and lumbar spine. It's straight. There's no deformities noted. Have you ever been diagnosed with scoliosis?
No, ma'am.
You have a straight spine. I don't see any kind of curvature at all. You can also inspect and palpate the spinal muscles. They're even, they're intact. Is there any tenderness noted throughout your back? Okay. So while we're back here, we can also assess for the costovertebral angle tenderness. So for him, which can kind of let us know, hey, is there a kidney issue going on? Is there an infection? Is there anything else kind of going on in this area? He said he had one kidney, so I want to make sure we do it on the right side where he has one kidney. So what I'm going to do is I'm going to put my hand on your back around the area of your kidney, and I'm going to kind of give it a little bit of a little push, okay? You tell me if you notice any tenderness, okay? Any tenderness noted? Okay. So he doesn't have any tenderness at the costovertebral angle. Next, while you're looking at the back and while you're assessing your patient, when you're taking your vital signs and you're looking for the you're counting for the respiratory rate, you can already take a look and see, is there symmetric motion when they're breathing? Do they seem to be huddled in one position to try to help them to breathe? Are they using any accessory muscles to help them breathe? So he's got symmetric rise and fall of the chest. There's no crepitus noted from the back. So you can put your hands in the back of the thoracic area and have them take a deep breath. Take a deep breath in. And you'll notice that you have equal expansion of your thumbs when they breathe, and they come back down when they're exhaling. So that's something that you can look at as well. You can turn around over for me. go back to the back right now. So we were looking at the back. First, we're going to palpate, okay? I was palpating in the back. I'm going to palpate your chest. There's no crepitus noted here. Now, since I already had him sit over here, I'm going to percuss from the front. Typically, you can start from the back. You do the lateral sides and you can do the front, but you can modify it as you need it. So I'm going to percuss. There's resonance noted, which is normal. Sorry, can you flip around for me one more time? Okay, we're going to percuss back here as well. And there's resonance noted. Okay, can you say the word 99 for me?
99.
And there's symmetric tactile fremitus noted while he's speaking. It's normal all throughout. We're also going to be looking, if you could raise this arm, you can also percuss on this side as well. Okay. And there's resonance noted everywhere, so that's good. He's got good, clear lung sounds that we'll hopefully listen to right now as well. So what we're also going to do is you can also identify the level of diaphragmatic dullness on each side. So what you can do is you're going to come to the back, and while you're percussing, once you get to the area of dullness, you want to make sure you've reached, as you've been palpating, you'll notice a change from resonance to dullness. And that kind of lets you know where your diaphragm is on both sides. And that's what I've noticed here. I can feel the diaphragmatic dullness here, which we've identified on both sides. So next we're going to auscultate. You're going to auscultate the same way that you palpated. Now I kind of did a little bit different here. I did his back. Well, I did the front, I did the back, and then I did the laterals. I did the sides of the chest. What you can do is you can start from the back, you can percuss, and go from one side to the next. And that's a really important thing when you're assessing for breath sounds. You're going to start at the top, and you're going to go to the side. Because you're going in a motion like this because you want to make sure that you're hearing equal sounds all along the same side. So we'll start posteriorly. Take a deep breath for me. Okay. Listen to the sides. Lift up this arm, please. Okay, we can flip around over to the other side. That way I can listen to the front. So he's got clear breath sounds throughout, no adventitious sounds, no wheezing noted. While you're palpating and while you're auscultating, you can kind of feel for crepitus at the same time, which I was discussing earlier. We already listened, I heard him talk, he's got equal tactile fremitus, he's got clear speech, no hoarseness noted. So next we're going to do the cardiovascular assessment. So it's really difficult to listen for other heart sounds. So the most important ones are S1 and S2, the lub dub. So we're going to listen to his heart. And what you want to do too, it's very easy to just put it over the chest so you can listen. But you're also going to want to look for the important areas. The aortic, which is in the second right intercostal space to the left sternal border. That's the aortic. The pulmonic is in the second left intercostal space to the left sternal border. And so you're listening for all the different valves here. You're also looking at the tricuspid valve, which would be the fourth left intercostal space on the lower left sternal border. And then the mitral valve, which is in the fifth intercostal space, the left intercostal space, mid-clavicular. And that's the apex of the heart. And you can hear the mitral valve there. So typically, if you have a bed, everything sounds good, your heart's right now. And, it's kind of good to tell your patients, like, they're nervous, you want to tell them, everything sounds okay. Something that you can also check for is jugular venous distension. You can look at that, especially when they're lying down, and there's various levels that you can see. But if you're looking at the side, even while he's sitting here, and if you were to lay back just a little bit, I don't see any jugular venous distension. You can typically see a large amount of distension if there's a serious amount, which he doesn't have any. So first, I'm not going to make him take off his shirt because we're doing a video. But first, really important for the belly, you want to just inspect first before you start poking around there because it can really hurt. So we're going to inspect. Do you have any pain at all? Okay. I'm not feeling. I'm just inspecting the belly first. I'm not palpating. So first, we're going to auscultate once we've inspected. So you want to look for bowel sounds in all four quadrants. He's got positive bowel sounds in all four quadrants. And I didn't notice a severe aortic pulsation noted. So I was inspecting earlier, now I'm going to palpate a little bit harder. I don't feel any deformities, I don't feel anything odd right away. So you're going to palpate lightly and then a little bit deeply for the liver, spleen, and it's really difficult to sometimes feel the kidneys, but you can do it. It's a little bit easier if they're laying down. What you can do also is you can percuss. You want to hear, you're going to hear resonance to dullness. Once you hear the dullness, you'll know that you're near the larger organs. So the liver, what you can do is on the right side, I'm going to adjust this a little bit. On the right side, you can squeeze the right side so you can start to feel a little bit. It's going to be difficult because he's sitting up, but you can squeeze using, when they're laying down, you can kind of squeeze on both sides to see if you can start to feel the liver. And that's going to be on your right side. On the left side, you're going to be looking at the spleen, and you're going to kind of be doing the same thing. You're going to be squeezing again as well to see if you can feel the spleen. The kidney can be pretty difficult. With him, since he's got his kidney on his right side, what I could do is I could stand on his left side, and I could begin to kind of, using my other hand, I could try to kind of lift up his back and try to palpate pretty deeply to feel his kidney. But like I said, that can be pretty difficult, and if you're a ticklish patient, sometimes that can prove difficult too. Something that you can do if you have a ticklish patient is you can kind of interweave your fingers together while you palpate, and that can kind of help. And I told you about percussing for the liver and the spleen. Like I said, you're going to go from a resonance, where the lungs are, to the dullness, where you're going to hear the organs. Next, we're going to look at the lower extremities. So I'm inspecting for hair on his legs. He's got equal but minimal hair on both legs. No deformities noted, no moles, no odd skin tags anywhere. Have you had any skin issues at all?
No.
Do you wear sunscreen when you go out?
Not usually.
If you're out there for long periods of time, do you try to?
I try to.
Okay, well that's good. So hair distribution is even. No skin changes that I can see. Have you noticed any skin changes at all? Any ulcers?
No.
His feet, the skin on his feet is intact. His nails are clean. They're dry. No deformities noted to his nails. So when you're looking at the legs, you can palpate for the various pulses. You can do the popliteal, which would be kind of behind the knee. Okay, and that's your popliteal, which I can feel. The posterior tibialis, which is kind of behind the ankle, which we can feel. And the dorsalis pedis. This kind of takes some time. It can be a small artery, so you want to make sure not to occlude it too hard, but you can feel it. Sometimes, thank you. Sometimes, if you have a patient, this is a patient that's coming into the office. Sometimes if you have a patient that's in the hospital and you're having a hard time feeling pulses, but somebody else can, it's really good. You can ask for permission first, but you can ask if you can leave a little mark. That way you know, okay, this person does have pulses all the way down here. He doesn't have any noted edema anywhere. Do you ever tend to have edema on your feet?
Edema.
Swelling?
No.
Okay, no swelling noted, no edema noted. That's another important thing when you're doing a physical assessment. Make sure that you don't use medical jargon all the time because they might not understand you. Okay, so while I was looking at the skin on his legs, you can also assess the skin throughout the body. I'm not going to make him take off his shirt right now, but if you could put your arms out for me. There's no skin lesions noted. He does have some scars from
cooking.
He does have some tattoos, but there's no infections noted. No keloid scarring noted. Have you had any skin issues anywhere on your body? Any skin changes, any mole changes at all? This is a good time to tell people to try to teach them about assessing their own skin, especially when they get out of the shower, just to keep an eye, especially for people who don't always wear sunscreen, to keep an eye for any changes in moles. His skin is normal for his ethnicity. It's dry, it's intact, it's warm to the touch. He's not clammy. His nails, like I said, on his feet had no deformities. His nails on his hands have no deformities. He doesn't even have any of the, sometimes you can see some of the horizontal ridges on your thumbs from stress. He doesn't have any of that. He's got clean, dry, intact nails. So I'm going to look at his joints. He's got equal joints. There's no inflammation noted, no bursitis noted. I'm looking at his lower extremities. His knees, there's no obvious deformities there. On his feet, though, on his left foot, the ankle is a little bit different just because of the club foot and the surgery that they did. His left foot is also flat compared to his right foot that has an arch. So, that's something, he told us that he had a club foot when he was a child, so that's not completely abnormal. So, he doesn't have any enlarged joints anywhere. So what you can do to assess range of motion, as you're asking your patient to move around the room, or can we get up and do this, can you come to this waiting room, you're kind of seeing their range of motion there too, especially if they're carrying things. So what you can do is you can do various angles, but you can have your patient stand up, and you can face the camera. So if you could extend your arms out equally, okay, behind you, forward, okay, down. He's got good range of motion. Did you have any pain on your arms when you were doing that? If you could lean forward, lean up again to each side, okay, to the other side, and then back a little bit, just be careful with the wall. Notice any pain noted when you were doing that? Okay, he's got good range of motion to his upper body. To your legs, if you could bend each leg, bend each knee, okay. Okay, and then if you could kind of swing them back a little bit, and then if you could lift them to each side. Okay, he's got equal range of motion there. If you could take a squat for me. Okay, he's got equal range of motion. Any tenderness noted to any of your joints? Okay, thank you. You can sit down. Okay, so what you can also do, so that was for the extremities. What you can also do, you want to see how strong somebody is. So can you push up against my hands on each side with your head? And you're going to feel a little bit of resistance, okay? Okay, how about towards the back? Okay, and with your arms too. I'm going to put a little bit of resistance and you're going to try to push up after me. So he's got good strength. He's able to resist against gravity and against weight. You're also going to do that for the legs as well. Okay, he's got good strength noted to all his extremities. And he's got good range of motion. Can you lift up your shoulders for me? Okay, bend your elbows. All right. He's got good range of motion there. He also has, could you extend your hands and fingers for me and your toes as well? He's got good range of motion in his digits, upper and lower. So he has 5+ strength noted because he's able to do resistance. Sometimes people, if they've been kind of weak, if they're, if they're malnourished, if, their protein is low and so forth, sometimes their strength isn't always going to be so well. So he was able to move against resistance to me. So that would be 5+. Sometimes there's different levels against gravity, or if they need a lot of assistance, or they're like 1+ if they're completely contractured and they're not moving. But he's got strength 5+. Since we've been talking to him, we've been looking at his mental status. He's a GCS of 15. Perla was intact. He's moving all his extremities. He was able to follow commands. So, we already know what his mental status is like. He's content. He's able to judge things about his life. So he's a competent adult. So while we're going to go over the various cranial nerves, and like I said, while we were going through the exam, some of the cranial nerves were already identified, but we're going to go over sense of smell, facial movements. We looked at his tongue already. We'll do the gag reflex. We did the protrusion of the tongue earlier. So we'll go over those as well. So what we'll do first is, first I'm going to give you 3 words that are unrelated. I'm going to do your cranial nerve assessment of what's left over, and I'm going to have you repeat those words back to me, okay? Pig, car, and 5. Okay, so I'm going to ask you to remember those later, okay? And that's kind of a test for memory. So we're going to do the sense of smell first. It's usually good to do something that's a pretty generic smell. Maybe you wouldn't want to do lavender. Maybe not everybody knows that. I wouldn't do Clorox. It might be a little bit too much. But these tend to be pretty generic smells. So I'm going to give you, it's unmarked. I'm going to ask him to smell it and identify it.
Cinnamon.
Yes, that's correct. Cinnamon is a pretty good generic smell. And this one? Coffee. Those are 2 pretty generic ones that are good. So his sense of smell is intact. We looked at his facial movements. I had him smile for me. I had him frown. He's been opening and closing his eyes. So we know he's got symmetric facial movement. I don't notice any Bell's palsy or anything at all. So the gag reflex, typically you could use a tongue depressor. But what we're going to do first, before I stick this in his mouth, I'm going to have you close your eyes, and I'm going to have you tell me what you feel.
Soft.
Okay, so that's soft. I used the Q-tip, so that was soft. Something else that we can use while his eyes are closed.
Sharp.
Okay, that was something that was sharp, so that's good. And you want to make sure you can do that on both sides. Can you feel that on that side too? And can you identify what that was?
Sharp.
Okay, so you want to make sure you can do that on both sides. And he's having equal movement and he has equal sensation on both sides. What you can also do is vibration. What you would use for hearing, the tuning fork, is what you can also use for sensory. So what you would do is you would tap the fork again and you would put it on various bony prominences throughout the body to make sure that sensation is normal. He doesn't have, any kind of neuropathies or anything, so we could assume that that would be pretty normal, but that's something that you can do as well. So can you tell me the 3 words that I asked you to remember?
Pig, car, 5.
Yes, so his memory is intact. You can also check for past memory. It's really difficult to do personal personal memory because you need somebody there that can verify that, but you can also use past news sources. We're also going to be looking, so while he's been sitting here, I can see that his muscle tone is normal. He's not atrophied anywhere. He doesn't have hypertrophy anywhere. So really quick, we're just going to look at gross motor movements. If you could do, what I need you to do is I need you to do this, alternating, and then you're going to go from thumb to pinky, and then from pinky back to thumb. And then try to go a little bit faster each time. And he's got good equal rapid movements on both sides. What you can also do is, if you could touch your nose with your finger, and then touch my index finger. No, your other. So that's another thing too. What you could also do with the patient is have them alternate their nose and their index finger with both arms. Can you do that for me? And he's got equal. There's a wall right here, but he's got equal movement there. Let's see. And the last, one of the last things you can do is the reflexes. Reflexes can be a little bit difficult because sometimes, it can be kind of difficult to palpate. You also need the little hammer, which I don't. But what you can do is, for the bicep with a hammer, you would put your thumb right here around the bicep. You would feel it in the antecubital fossa area, and you would get your hammer and you would hit it against your thumb, and you would see visible flexion of the elbow. Then what you could also do, where am I? The tricep. So you would have them bend their arm like so. You would have them rest their arm right here, and you would use the hammer right here. And with the tricep, you'd be looking for visible or palpable extension of the elbow. Then you'd also be looking for the brachioradial. So you'd put the arm straight, and you would rest the arm in your hand, and you would put the hammer right here in the brachial kind of radial area. And you would see pronation of the forearm and flexion of the elbow as well with that one. Now let's see, where was I? The patellar is pretty easy. That would be the knee. You would put the hammer right here. You don't want to be too close to the patient because they might jerk a little bit. But there's going to be the extension of the lower leg. And then finally, the Achilles tendon. You would put the hammer to the back of the Achilles tendon, and it causes plantar flexion of the foot. For Babinski's, you would see that in children typically less than a year old. If you're doing a plantar reflex of the foot, you're going from the lateral side of the foot, from the heel to the ball, across to the medial side of the foot, and you're going to expect to see a plantar flexion of all the toes. They could be really ticklish, so you might see the Babinski. But the Babinski, if you see that in an adult, that's typically common for neurological damage, and you will see that in neurologically damaged patients. You're going to see reflexes that shouldn't be there, like the Babinski. We're not going to do the genital and rectal examination right now. So what we could do for the rest of our exam, I could talk about diagnostic tests, maybe about his kidney, if he starts having any issues with it, possible CT. I can take his blood pressure again to make sure it's not too high. I can suggest smoking cessation programs, and if there's anything else he's concerned about, if he wants to, eat better, we could talk about nutrition, various things like that. But that is the whole physical examination. So I appreciate you watching, and he appreciates you watching too. And I'm sorry there was a cat, but I appreciate it, and I hope you enjoyed my video. Thank you.